So here we are on chapter 8 for the joints. Yeah, there's a lot of information here. I'm going to skip through this because I just went through them. Okay, so here we are. Okay, how are we going to know and study the joints? We are going to start with the classification of the joints. So here we are going to look at types of cartilage or types of material that is in the joints. Okay, so you're going to have different types of classification. You're going to have functional and also of material that is in the joints. Okay, we're going to look at fibrous joints, cartilaginous joints, also synovial joints. You're going to have to know which ones are the real joints that we call they have a lot of movement. Okay. Then we'll look a little bit at what happens when things go wrong. Okay, just a little bit of pathology with the joints. Okay, happen to be common. Okay, so articulation or arthrosis, this is when you have two bones that meet. So when two bones get together, you call that space articulation or arthrosis. Okay. What is in between the two bones? You can have cartilage, you can have also ligaments or tendons or muscles, or sometimes you can even have bones, bone tissue that form between the joints. So we're going to see, distinguish, also identify the strange names that goes with these joints. And sorry, not my fault, but we try to make it as simple as possible. Okay. Again, here is the idea that when you have a very mobile joint, you're going to have less stability. So the more mobile the joint, the less stable it is. Okay. So two types of joint classification. You can have functional, and that means how much motion the joint has, or you can have a structural type of classification. That means what is making up the joint. Okay. So first looking here at functional classification. So that's the amount of movement that the joint is going to allow. So there are three names, three classifications for functional. Okay, so that's this is when we start seeing the weird names. Okay, so let's try to make them memorable, or at least try to understand what they're saying. Okay, the first one says synarthrosis. Okay, syn means without. Okay, so again, if you're speaking a Latin language, that comes in handy, because sem means without in Portuguese. I believe it's the same in Spanish, right? Anybody speak Spanish here? Yeah, how do they say without in Spanish? Sin? Sin. So that's the same. It's even better than the Portuguese. Portuguese is saying, so Spanish sin. So sin means without movement. So here, synarthrosis is immovable joint. Okay. Then you have another one that is like a little bit of joint, mainly immovable, but just a little bit of movement. You call that amphiarthrosis. So it could be not really moving, a little bit moving, like kind of both ways. So amphiarthrosis, slightly movable. And then you call the really moving joint, that's the diarthrosis. Okay. So without movement is seen, amphi is a little bit, the real moving one, that's the diarthrosis. Okay. Everybody clear with that? Okay. And here we have the structural classification. So you got four of them, okay? Structural. So what kind of material is in the joint, okay? You have four types here. So you have fibrous joints, cartilaginous joints, synovial joints, and bony joints. Okay, so instead of just describing here, it's better to look at pictures and examples than try to just give a description here. Okay, so let's start. Well, another point. Told you, a lot of points today. So this one says, which of the following correctly lists the three structural types of joints? Okay, I got some people there between two answers. Yeah, this is when you can talk to your friends, you know. I know it's late afternoon. Some of you are tired. Some of us didn't manage to have lunch. Kind of hungry. If you actually manage to fast most of the day, this is when your brain is actually working better. Yeah, hard to believe. Anybody need more time? Everybody good? Huh? You need more time? Okay, a few more seconds. Okay, I'm gonna stop it. All right. What is your answer?
C.
C, yes. So this is your, okay. Fibrous, cartilaginous, and synovial. That is a structural type of joint. Okay. Okay, so this is from your book and is showing you the type of structural joints, right, that we're looking at. And we're going to go one by one of this classification and give you examples of what they are. So starting here with your fibrous joints, okay? Now, most of your fibrous joints here, they are not movable. So they are without arthrosis, synarthrosis. Some of them have a slight movement, right? And I mean, most of them are really without movement. But then you have different types of joints that don't have movement. You have the joints that are suture joints, and those type of joints you're only going to find in the cranium. Okay, and then you have also mainly immobile joints that are called gomphoses, and those have to do with the teeth connection to your bones. Okay, so let's look at these fibrous joints. Okay, so this is straight from the worksheet, also from the extra study material. Okay, so fibrous joints. What you're going to have in these fibrous joints, you're going to have a lot of dense connective tissue that is made of collagen that is stabilizing the fibrous joints. Okay, so those types of joints, they are mainly going to be part of sutures that is also kind of bony material. So you have collagen and bone material. Then you're going to have gomphoses, and those have to do with teeth attachment. And you also have syndesmoses, and those have to do with joints that are part of interosseous types of membranes. Okay, don't go crazy. We're gonna get examples of them. Okay, so here are the first one. So the type of sutures. The only type of joint type that you find sutures is really in the bones that are in the head, in the cranium. Okay, so when you see these types of joints, you see they go on a zigzag line, and they really make this puzzle-looking type of fitting between the bones. Okay, so what is in between these bones? At first, you're going to have very short, very dense, irregular type of connective tissue. Okay, now why is it short and dense and irregular? Because you don't want these bones to disconnect from each other. And also, if you put pressure in one side of the bone, let's say you bump your head somewhere, you want that force to be distributed throughout the surface area. So you want to have irregular connective tissue that is going to be capable of distributing that force and dispersing the force. Okay, and of course very short because this is a very tight type of joint. Okay, so at first you have this type of joint, but as you get older, meaning after 50 years old or so, you're not even going to have this type of short, dense connective tissue. You're going to have bone tissue that is going to be this ossification of these joints. Okay, so the joints are really going to be fused. And I mean, this is amazing that it only happens after you're about 50 years old. Okay, so I can imagine my bones are just starting to fuse. Okay. So that is your suture type of bone. Okay. So here we go to the other fibrous type of joint. So here's your gum fauces. Okay, so the gum fauces is really this type of joint that is between your tooth and the tooth socket. Okay, so you're gonna have here your mandible, and what is the name of this other bone here? This bone. Maxillar, right? So maxillar and mandible, this is when you're going to have your sockets for the teeth, and here is where you're going to find the joint. Okay, you also call that periodontal ligament. Okay, so you're going to have dense irregular connective tissue there. Now, is this totally without movement, or do you have a little bit of movement? Some movement, a little bit, not much, right? But this is what allows us to fix up your teeth in case they're very crooked. We can put braces and kind of, allow them to be fixed up in a certain position, okay? So a little bit, not much movement on this periodontal ligament. Now, you look at this. This periodontal ligament is right under the gum, okay? So here is your gum. And if you have healthy gums, you should go all the way close to the enamel of the tooth. After the enamel close to the gum, you have the root of the tooth that goes down, right? And then here, you're going to have this periodontal ligament. Now, some people have gum disease. That means you see like a very long tooth and you see that the gum is not covering all the way to where it's supposed to go. You have gum recession. Some people have that because maybe they're brushing their teeth too hard, or maybe because they didn't brush their teeth correctly. If you're really tough brushing your teeth at the gum, you're going to damage your gum and you're going to be exposing this area of the tooth. That's a bad thing, because then you can get periodontal disease. You can get bacteria to go in there and start to damage this area of attachment. Okay, that can lead to tooth loss. So make sure that you're always following up with your dentist, with your hygienist to make sure you don't have periodontal disease. Okay. All right. Okay, another type of joints here, your syndesmosis types of fibrous joints. So here is syndesmosis, you're going to have ligaments, okay? Ligaments are the fibrous tissues that connect bone to bone. So ligaments here for this joint. So you're connecting two bones. This thing here is technically a joint, okay? So this is made of very much dense, irregular fibrous tissue, okay? Now, this we have seen in your arm and on your legs, okay? The interosseous membranes. So here is showing you the interosseous membranes of your legs. Okay, so besides this interosseous membrane, you also have this other ligament here that is bone to bone, but then this type of ligament is not irregular. It's dense, but it's regular type of ligament. So here you have a different type of orientation than you have with your interosseous membrane. Okay. Now, this type of joint allows just a little bit of movement. Okay, not a lot of movement, but it's not totally immobile. Okay. Oh, another point. Lots of points today. Okay. Of the following types of joints, which type occurs only in the skull? So that is an easy question now that we just looked at it. Does anyone need more time? Everybody done? Okay, I am going to stop it. Okay, what is your answer? Hey, that's your suture. You're only going to find that. Okay. You're only going to find that in the skull. That's the suture. Okay. All right. So now going to the next stage of cartilaginous joints. Okay, so these are going to be quite interesting. Let's see here. They're not totally movable yet. Okay, so you have limited movement, and you're going to have basically two types of joints here. You're going to have the synchondrosis and symphysis. You have to distinguish them, that the first one here is without movement and is made up of cartilage, right? Is not other type of fibrous connective tissue. Okay, so this is without movement, that is cartilage, and this one here is symphysis, that has a little bit of movement, but not much. But it is a different. You're only going to find in a couple of places. The type of cartilage is also going to be different. Okay, so let's see here what you need to know. Okay, where you're going to find synchondrosis. Synchondrosis, they are mainly made here of hyaline cartilage. I added this after I uploaded your PDF. Okay, I added this just for clarification. Okay, although I had it down here, it wasn't very obvious how you distinguish what this synchondrosis is. Okay, so synchondrosis joints are made up of hyaline cartilage. You're going to find it in everyone. You're going to find it between your sternum and what is this bone over here? Which one is this bone over here? That's your first rib, right? That's your first rib that is coming all the way from your vertebral column right there. So the first rib that goes to the sternum, to the manubrium, right? This cartilage right here doesn't move. So this is your hyaline cartilage that is not moving and is connecting your first rib to your manubrium at your sternum. So this is a synchondrosis. Another place that you're going to find this hyaline cartilage that doesn't move is with a growing person. This line here, remember what that is? Your epiphyseal plate. That's the place where your long bones grow, right? So you have a growing person, you're going to find the epiphyseal plate that is made up of cartilage. And then later on, the cartilage tissue gets substituted by bony tissue, right? And then after you stop growing, you get osseous tissue that makes your epiphyseal line, right? But when you have the epiphyseal plate, this thing is hyaline cartilage. Do you want this joint to move? No. Imagine if you have a child running and this joint is moving and the poor kid is trying to keep the balance and the legs are going all over the place. That's not going to be a pretty sight. And it would be also a site that is easily broken, which actually that's what happens in case of accidents. Kids can break their long bones at the epiphyseal plate. Okay, so this joint doesn't move. Okay, and they're both made up of hyaline cartilage. Okay. After you're done growing, the epiphyseal plate becomes bony tissue. So after you don't have cartilage anymore, then this thing becomes a synostosis. Okay, so this is osseous tissue that does not have movement. Okay, so it changes from synchondrosis, that it has to do with cartilage, to synostosis after plate closure. Okay. What about this joint over here? Does it ever change? No, that is hyaline cartilage throughout life. Okay. Okay. So here is your symphysis. The type of cartilage that make up the symphysis, that's fibrocartilage. We have seen that before when you talk about the discs. Okay, so the outside part of the disc is made up of fibrocartilage. Actually, the disc is kind of like sandwiching hyaline cartilage in the middle. Okay, but the outside is the tougher part that is more for shock absorption. Okay, and some movement, but mainly shock absorption. Okay, and weight bearing. So here you have this type of symphysis. Another place that you find symphysis is when you have your pubic bone this is your pelvis, right? That is joining right at the front. So this you call the pubic symphysis. So this is fibrocartilage right there. Does that joint move? It depends. In males, it doesn't. In females, it moves a little bit when you're pregnant and when you're ready to give birth. So it can kind of give a little more space for passage of the huge baby's head, right? So depends on levels of hormones, right? So basically during child labor, this pubic symphysis can give you a bit of flexibility, but otherwise it doesn't move. Okay, so this is all fibrocartilage. Right, so this is also from your study sheet, and I like the way they put it here. That is say symphysis. What is symphysis? M is for midline of the body. So you're going to find symphysis at the midline of the body. So yeah, if you look at your at the spinal at the bones at your spine, you're going to find the symphysis that is part of the middle of the body, right? And pubic symphysis is also at the middle of the body. And then this is for the M. Now the F part is for fibrocartilage. Okay? It's for anything else that you're thinking about a F subject. No, it's fibrocartilage. All right. So middle of the body, fibrocartilage. Okay. Mainly you have just a little bit of movement or no movement. So you classify that as amphiostenosis. Okay. And here is a table that I also added just like a few minutes ago that puts a little summary on the type of joint and the comparison. Okay, so synchondrosis with hyaline cartilage, symphysis with fibrocartilage, and the rest of the comparisons. Okay. All right, so here looking at these guys that are amphiarthrosis. Okay. So they move a little bit more than the thing that doesn't have movement at all. Okay, so it has a little bit of movement. So they are stronger than those diastroses. Diastroses is the one that moves a lot. Okay, and they might be made up of different materials. So you can have either fiber or you can have cartilage. Okay, so basically you're going to have two types of those amphiarthrosis. You're going to have syndesmosis, or you're going to have the symphysis. So symphysis is also a type of amphiarthrosis. Okay, so let's see here what we have. Oh, more questions. Okay. All right, so this one says, when someone has slipped a disc of their vertebral column, which type of joint have they disrupted? Okay, vertebral column. Oh, I'm glad nobody's answering. No, I just said I'm glad nobody's answering D and somebody pressed D. Okay, thank you. It's not D. Okay. Okay, consult your friends, get your points. Where is it the suture is going to happen? Get it in your head? If you're saying suture, change your mind. I don't get it. I'm telling you to change your mind. Are you awake? I don't know who you are, but okay, I'm going to stop it. You're missing points. Anybody need more time? Okay, what is your answer? C. It is C. If you answer anything else, you can talk to me after class. I'll give you a chocolate. All right, so Next one on the line, synovial. Those are the fun ones. Okay, a lot of stuff to do with synovial joints. You're going to have a lot of types of movements and types of joints that allow for the movements. Okay, so when you're talking about articulation, you're mainly talking about synovial joints. All right, so where you're going to find it? All over the body. Anything that moves, it's mainly a synovial joint. Okay, what you're going to have in there, you're going to call them basically, those are the true moving one, diarthrotic, and mainly they're going to have some fluid-filled cavity that is going to allow smooth movement to happen. Okay, so you have joints in your arms, on your legs, and here is not showing, but also on your mandibule. Okay, so you have these freely moving joints. Those are really your synovial joints. So what is making here synovial joints? Parts of the synovial joints that you should absolutely know, right? So the many parts, we're going to focus only in a few of them, okay? So you do have a fluid-filled type of place here, okay? And you have protecting each one of the bones that is involved with this joint, you're going to have this hyaline cartilage right there. Remember the chicken bone? When you eat the chicken, the part that is crunchy on top of the chicken leg? That's your hyaline cartilage that was protecting that chicken's bone, okay? So if you have healthy hyaline cartilage, your bones are not going to touch each other. Because remember, when you have cartilage, you're not going to have nerve endings in the cartilage. You're not going to have blood vessels in the cartilage, right? You're just going to have this material that is going to cushion and protect the ends of the bones. Now, when you look at the bone itself, remember, you're going to have a lot of nerve endings and a lot of blood vessels. So if it happens that you wear away the cartilage and you get bone to bone, they start hitting each other, that thing hurts a lot. Okay, so this is what you call arthritis, one type of arthritis. There are many types of arthritis. Okay, so articular cartilage, you're going to have this protective hyaline cap. Okay, now let's see here. You're going to have this fluid-filled space that you call synovial cavity right there. Okay, how much fluid is in there? Well, if you look at your knee joint, that is the biggest articulation that you have in the body, how much liquid can you put in there of this synovial fluid? Any guess? No? Not a lot, like 3 milliliters. It's like this much, tip of the finger type of amount of liquid. But that is enough to help to absorb the shock and allow for a smooth motion of the joint. So you're going to have this fluid-filled space. This is filled up with a synovial fluid. Okay. All right. So besides that, you're going to have these capsules. So here it is showing one capsule. Okay, it's here the synovial membrane. Okay, and in this case here is showing you the inner synovial membrane. This membrane is very, very important because it's the cells of the synovial membrane are the cells that are producing the synovial fluid. Okay, now after the synovial membrane, you're going to have another tougher type of membrane that goes right on top of this one here, but here is not showing. Okay. Here is just showing this outer fibrous membrane that is the osseous membrane. But here is not showing you there. It's just showing your synovial membrane. So you also have this external fibrous layer, okay, that is not showing here. Okay. So here, when you look at the synovial fluid, a lot of the synovial fluid is made up of certain modified sugars. One example is hyaluronic acid. Yeah. So you heard of hyaluronic acid? Yeah, and you heard of it in like beauty creams that you can put on your skin to help with avoiding wrinkles. Right. Basically, hyaluronic acid is composed of sugars that have a lot of negative charges. So the negative charges attract water molecules. And basically, it makes this type of gel-like. Remember the easy water? Yeah, like all the way from the beginning of Past Life in A&P1? Easy water? So now we're talking about some type of easy water in your synovial fluid as well. So you have this gelatinous-like substance that feels more like egg whites. Okay, that is filling up this cavity right there. And mainly you're going to have a lot of hyaluronic acid. Actually, some treatments for degenerating joints, especially knee joints, is injection of hyaluronic acid to replenish the fluid and allow a better cushioning of the joints. Okay. Now, what you're going to find here, besides hyaluronic acid, you're also going to see some cells that are protective, cells of your immune system, and those are phagocytic cells. Okay, and the reason why they're there is that you need to kill any type of pathogen, especially some bacteria that can get into this synovial fluid. Okay, because certain bacteria will lead to arthritis. So if you have your immune cells that are taking care or destroying the bacteria, you can protect your joints from bacterially induced arthritis. Okay, so you have a lot of hyaluronic acid, and you also have those phagocytic cells. All right. So besides your fluid, you're going to also have several ligaments that are going to go around the joint to protect it and give it stability. Okay, so you have reinforcing ligaments. Okay, so besides that, at the outside part of the joint, you are going to have blood vessel supply and you are going to have nerve endings, not inside of this fluid filled space, but right on the outside of that coating. Okay, so outside of those membranes, you're going to have nerve endings and blood vessels. Okay, and this is also another reason why when you have some injury to the articulation, to the joints, it's very painful because you do have those nerve endings to send you pain signals. All right, so here, more on your synovial joints. Okay, so you are going to have some very tough fibrocartilage discs that are positioned strategically around the joint. And you call those, individually, there is called meniscus. And if you put a lot of them together, those are called menisci. Okay, so several of them around the joint to help for stabilization. Remember? No, not yet. Okay, to help with stabilization and to have a close fit at those joints. Okay, so those are made up of fibrocartilage. Okay. Oh, sorry. Here, those here. Those are bursa. Okay, so these ones here are meniscus. Okay. Now the bursa. What these bursa are, those are sac-filled like a balloon-like. If you get a party balloon and you fill up with water and you move it around, you see that it's easy for two things to glide on top of each other with this fluid-filled balloon in the middle. So this is what we call the bursa. Okay, so you have bursa in the like cushioning the big joints, like on your shoulders. And also at your knees and other places. Okay, not only they are cushioning the big movements between the joints, they also help to cushion around tendons. So tendons are connecting bone to muscle. Exactly, tendons connect bone to muscle. Ligaments connect bone to bone, right? So here you have this elongated bursa-like sacs, so you call them tendon sheets. Okay, so they're elongated bursa that cover the tendons and diminish the friction between the moving part and the tendon. Okay, so those are very important for cushioning and for minimizing friction. And they are also filled with synovial fluid. You're not going to have empty spaces. So you do have fat pads that will fill up anything that would be empty space. So it's fat, right? Okay, so fat pads on your joints. Right? If you have something that's going to be empty space, you just put fat in there. So it helps with the cushion. It helps with also absorbing shock and avoiding friction. All right. All right, so this is another exercise from your worksheet, okay? So you can read that on your own and just emphasizing what it's saying. Okay, yeah. All right, so now how the joints are going to move. So range of motion. In order to move something, you need to have the origin. So this is a place that is not going to move. So this is going to be the attachment to the bone, okay, the origin. And then the insertion is the part that is going to move. So when you look at a muscle, like for example, your biceps, you have the origin that is in your humerus, and your insertion is going to allow your arm to move up, okay? So the insertion is the part that moves. Okay. Now, the type of motion that you have, this is when you also have to look at those strange names. A lot of them are just intuitive, but some other ones you really have to think about it, okay? So you have non-axial type of movement that's like slipping on top of each other. You have only one way of movement, or biaxial or multiaxial. Let's look at examples that makes it easier to understand, okay? So three general type of movement. You're going to have gliding. So gliding on top of each other, the bones are gliding. So you always have the joints, synovial joints, right? You have angular movements. So that's the type of movement that you see with your arm, right? Angular movement. Now, with your angular movement, you're going to have words that you should know. So flexion, this is when you bring it closer to the body. Extension is when you take it away from the body. And then you have the hyperextension, which you're not going to see from your arm because it stops right there. Right? When are you going to see hyperextension? Like for example, with your head, you can do the flexion part if you look down. You can do extension, bringing back up. And you could do a hyperextension if you look all the way to the other side. So if you pass your midline, that would be hyperextension. If you do a hyperextension with your arm, you're going to break your joint. Don't do it, okay? If you have abduction, you're going to take it away. You abduct somebody, you kidnap somebody, you take it away, right, from the family. So abduction, you should know. Adduction, you're going to add back. You put it towards the body. Circumduction is in around circles, all right, which is different than rotation. Rotation is in the same axis, you move things around. Okay, so here, gliding movements. Where are you going to find gliding? When you have your intercarpal joints, so that's going to be at your hand, or you have your intertarsal joints, and that's going to be at your feet. Right? So that's the gliding movement that is showing here. Okay. So here you have the example of flexion and extension, and then here is hyperextension. Okay. So very simple. And you can do that also with the trunk of your body, right? You can do a flex, like you do abdominals and extension back to place. Hyperextension, if you don't have lower back problems, then you can actually do the hyperextension, right? Have you seen those Shin Yun dancers? Yeah, have you seen them doing their practice exercises, warm-up exercises? It doesn't look normal, it doesn't look human. They're made up of rubber. I don't know how they do the hyperextension, that the back go all the way, like touching the back of their knee. Have you seen that? It is, I guess, humanly possible. It's just not very normal, right? But there's like a hyper extension. All right. So these types of movements. All right, so this is easy to know. Abduction, going away from the body. So everybody, let's go abduction movement. Abduction. 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 And they will fly abduction, abduction. Okay, just so abduction, abduction. You know that one. Circumduction. Let's do a little circumduction exercise. Circles. Cone-like circle, not any circle. Cone-like circle. Circumduction. All right. So here, cone in space. All right, so here, rotation, very easy. Rotate your head in its axis. You're not doing the cone thing, okay? Rotating, that's right. Rotate your arm, all right. Rotate your foot, you know what to rotate, all right. This one we've seen before, supination, pronation, right? So if I come with a question like, if you have a hand in this position, what do you call that type of movement? You should be able to identify that on the test question, right? All right, this is cool too. Dorsiflexion and plantar flexion. When you do a dorsiflexion, you're going to kick a soccer ball. You bring your toes up. When you do a plantar, is the plane of the foot, plantar part, you put it down. If you dance ballet, you do a lot of pointy plantar toe torture type of flexion. Right? Have you seen the toes of ballet dancers? Oh, poor creatures. All right, a lot of plantar flexion. And also you can get inflammation of the plantar part of your connective tissue. You call that plantar fasciitis. Also very, very painful. Okay. Inversion and eversion. Inversion of your feet, you bring it towards the body. Eversion, you put it away. Inversion, put it in. And this is a cool one. Protraction and retraction. This has to do with your mandible. Okay, so protraction, you bring it forward, and then retraction, you bring it back in. So it goes out, it goes back in. That is useful when you're using your teeth to grind stuff, right? Besides that, your mandible does other types of movements. There's a lot of movements with your mandible, right? So you can have elevations, you can have depression. Okay, elevation, you close your mouth, depression, you open your mouth. Easy. Okay. And another movement, you have your opposition of your thumb. Okay. Thumb is very good for opposition. Okay. All right, so here is a table from your book showing these types of movements. And let's see if we have time to get to the fun stuff. Okay. All right, so types of synovial joints. 6 types. You go from more movement to less movement. Okay, so let's look at this type of joints and where you find them. First one here is the ball and socket. So that's the one that allows you the greatest range of motion. You're going to find that on your shoulders, right, at the girdle, pectoral girdle, connection with your femur, with your humerus. I changed my legs for my arms. With your humerus, right? And you're also going to find it at the hip girdle, right? You're going to have your pelvis girdle and it's going to connect to your legs. Now, the ball and socket motion of your arm is a lot more than the motion that is at your hip. Okay, so it's easier to dislocate the arm than it is to dislocate the leg, the femur. Okay. Following that, you have this condyloid type of motion that is not quite a ball and socket. So this thing here is not a ball, and that kind of looks like a socket, right? So this is called condyloid. You have a lot of motion that is allowed, okay, sideways, two ways, and also around. And you find the type of joint at your phalanges, a connection of metacarpals with phalanges, okay, with your fingers. You get that type of joint. Okay. The next one, which is again not as much movement, you have this saddle type of joint. Okay, you're going to find that at the base of the thumb. Okay, allows biaxial movement. So this is an important word to know here. Biaxial movement. It moves either this way or that way. Okay, that's the joint at the base of the thumb. Okay. Plain type of joint, that is going to be with your metacarpal type of discs. Okay, it's going to be just gliding, sideways gliding. You see there's no curvature in those joints. Okay. Hinge joint, where you're going to find this at your elbow. It's like the door, okay? Door, and this type of joint is only angular movement, and we call this uni-axial movement. So you can only do this type of motion, okay, with this type of hinge door joint. Okay. And the last one here is a pivot joint, and that you're going to find with the radius, okay, that can go around pivoting on a certain axis here. Okay. It's still a type of movement, very much uniaxial, that's what you call it, okay? Uniaxial type of movement. So if you look at the joint, you should by intuition see what kind of movement is doing. All right. So this joint over here, temporal mandibular joint, is joining the mandible with the temporal bone, right? So this joint is kind of like very flexible. It has a hinge type of joint. It has a gliding type of joint. So you can go up and down, you go forward, front and back. And because the joint is so flexible, you have so much motion, a range of motion, this is actually the joint that is the easiest one to dislocate in the body. Okay, so how would you dislocate that joint? Well, let's say you fall and on your chin and kind of gets the joint out of place. Or if you're involved with boxing and you get, one of those, kind of things. You can imagine how you can dislocate the joint, but it's easily dislocated. Okay. All right, so here, this other example here you have with your elbow joint. Remember, that's a hinge type of joint. Okay. You can do flexion and extension, simple type of movement. Okay. When you compare that with your hip joint, remember that is also ball and socket, but this socket is quite deep. So that is one factor that limits the amount of movement of that joint. Okay, and where you're going to find that, remember that this place here is called the acetabulum. Okay, and what else is important to know here? Okay, so basically that's the whole thing to know here. Is a ball and socket, and this is as the acetabulum. It has less range of movement than when you compare with the pectoral girdle. Okay. And here, interesting things about your knee joint. This is the most complicated joint that you have. It's also the biggest joint that you have. Okay, so you have several bones that are joining here. Okay, so you're going to have your femur, and you're going to have the tibia, right? Besides that, you're going to have the sesamoid patella joint right there. And you are going to have a lot of tendons and ligaments that are going to stabilize the joint. You have the bursa, several bursa that are all around for smooth movement. You're going to have fat pads right there. Okay, so let's see what type of movements that you have. You can flexion and extension. Same thing as with your arm. Okay, so when you look at the knee joint, you're going to find a lot of ligaments. Ligament is bone to bone, right? So you need ligaments to stabilize that joint. Okay, so if you're looking here from the front view, you're going to find this ligament that is called the anterior cruciate ligament. Or you can also know this by the ACL. Anybody heard of the ACL before? Yeah, anybody play sport? And then if you hurt something on their knee, it's usually the ACL, right? It's very prone to injuries if you're kind of an active person, okay? So besides that, you're going to have meniscus, right? Meniscus type of fibrous tissue to help with cushioning of the joint. Okay? And here is where we're really emphasizing your ligaments. Okay, so here you have your anterior ligament, And you also have a posterior cruciate ligament. But the anterior one is usually the one that is more vulnerable to injury. So here, in order to see those ligaments, you also actually have to take away the patella, the kneecap. Okay, so you can see those types of ligaments. You call those intracapsular type of ligaments. Okay. So here, showing an illustration of what happens in case of horizontal type of blow to the knee. Okay, so you're standing in a vertical position. If you have something exemplified here as a hockey puck going towards your knee, right, the back of the knee here. So most likely you are going to get injured at the ACL, like right there. Okay. We could also have other types of ligaments that can be damaged, but the ACL is usually like the first one to give out. Torn ligament. Okay. And then you have these other types of injuries, like bursitis types of injuries. When you get inflammation of the bursa, you can either get bursitis by falling on your knee, or you can get bursitis, for example, when you overuse the joint, like for example, when you play tennis. And then you get, bursitis at your elbows. Okay, so this is inflammation of the bursa. You get overfilled, and you get, inflammation and pain. And here is an example of when you fall on your knees, and not only you get bruises, right, but you also get this bursitis due to fall injury. And yes, those are my legs, and this is, my bursitis knee type of injury. It was quite painful, but then I was on the ice. I was like ice skating, so everything was pretty much frozen. I just felt it like next day, very painful. Okay. Anybody had this kind of injury, like knee injury before? Yeah, not fun, not fun. So what do? You rest your injured joint, put ice, and then you put some, heat therapy, and eventually it goes back into place. Okay. So bursitis, right? How you get bursitis? You can either fall on it or have a blow to it, or overusage. So friction, a lot of joint usage can give you bursitis. Okay. Another type of problem with the joints is tendonitis. So inflammation of the tendons, usually because of overusage. Okay, so tendonitis. You can have also at the bottom of your feet, if you're a runner, you can have inflammation of the tendons. Okay. Right. So things that happen to joints, and in case you have arthritis and you need a joint replacement, yeah, you can go through joint replacement surgeries, right? So in this case, it's a hip replacement, right? So they have some type of titanium or other metal with some type of silicone or strong type of plastic that can substitute your natural joints. And here is also showing you a knee replacement. So that was hip replacement, so this is a knee replacement type of surgery. Okay. Other problems that can happen with joints, there are arthritis. Okay, so in this case here we're showing rheumatoid arthritis that gets to be kind of deforming. Okay, you have a lot of types, lots of types of arthritis. Some of those are caused by bacteria. Some other types of arthritis are caused by autoimmune disease. So your own body, your own immune system makes antibodies to attack your joints. Or you can have immune system cells that directly will attack your joints. Okay, so those are types of arthritis. So the most common type of arthritis is osteoarthritis. This is mainly due to overusage and wearing out of the hyaline cartilage. So this is going to have bone to bone. So this is the osteo part, osteoarthritis, bone to bone. The one what is shown here is rheumatoid arthritis. So this is, it could be caused by bacteria, or it could be autoimmune disease. Okay. And another type of arthritis that you have is called gout or gouty arthritis. So those are deposits of uric acid crystals in your joints. Now, when you talk about gouty arthritis, you're mainly going to talk about problems of your big toe, because that's where those crystals like to accumulate. Okay, they are heavy, they go to circulation, and they get to your toe, and then they like to come up back in your circulation. And it's very painful, very painful. It's like your toe is on fire, okay, very painful. All right, so here is just a bit more of explanation on rheumatoid arthritis. Now, usually the people that develop this type of rheumatoid arthritis that has to do with autoimmune disease, it's women. So you have 3 times more occurrence in women than you have in men. And actually, most of autoimmune diseases are a problem of women after middle age. Okay, just so for FYI. Okay. And that was the last of the slides.